All right. Good evening, everyone. I am Dr. Noori, Senior Editor at BJN. I warmly welcome you all at Homeo Insights 2026, a webinar series in collaboration with LR Shah Homeopathy College, Gujarat, hosted by Homeopathy 360. It is my pleasure to introduce our speaker, Dr. Mohit Nanani, who will be presenting on the topic Eternal Enigma, Geriatric Constipation and its Clinical Homeopathic Approach. This webinar will comprehensively address the common challenges faced by the elderly due to constipation, highlighting individualized homeopathic remedies, miasmatic correlation, and the psychodynamical understanding of constipation in old age, offering a well rounded clinical perspective. Dr. Mohit is a highly professional homeopathic physician with over 3 years of clinical experience, currently practicing at Pragna Homeopathy Clinic, Rajkot. He is also serving as an assistant professor in the Department of Practice of Medicine at LR Shah Homeopathy Medical College, Gujarat. He has actively contributed to academic research, including a research paper presentation at Fortune 2022, and has multiple publications to his credit. In recognition of his clinical excellence, he is also a recipient of the Swara King Award for Excellence in Clinical Case Taking. We warmly welcome Dr. Mohit and look forward to an enlightening presentation. Sir, we welcome you on Homeopathy 360.
Thank you very much, ma'am. So shall I share my screen and begin the session?
Absolutely. So while Dr. Mohit is sharing his presentation, a quick note for the audience: if you have any queries, please put them in the Q&A box and we'll try to take them up and get the answers from our speaker at the end of the session. The stage is all yours, sir.
Thank you, ma'am. So the screen is visible. Hmm?
Yes. Yes, now we can see it.
Okay. Okay. So my today's topic is eternal enigma, geriatric constipation, and its clinical approach. Mainly, eternal enigma. I put the word because of it is a very common issue, a very challenging issue in our daily life, but it is very seen as a very small diseases. So I would like to put a light on this issue, addressing its clinical approach for today's session. So moving forward, so why it is an eternal enigma? So chronic constipation is a common yet neglected problem in geriatric age worldwide and in India. Stool frequencies decreases with the age and sedentary lifestyle. Elderly females are more commonly affected. We all know that as the age passes, the people, mainly old age people, suffers from constipation. And it is a chronic constipation. It is not just a symptom. It is a disease. It is a disease of the bowel, due to which they suffer a lot, and the quality of life is also affected. If we see epidemiologically, the prevalence or the global prevalence is also about 14%, while in Indian studies it shows that 53% there is a self-perceived constipation. As I told, it significantly impairs quality of life and is associated with insomnia, anxiety, depression, and other serious complications like rectal prolapse, hemorrhoids, diverticulitis, obstruction, and mainly there's an increased risk of colon cancer, which we all know about. Because after breast cancer, we always suspect case of a colon cancer. So the constipation, which is chronic constipation, is also a risk factor for the colon cancer. Polypharmacy in old age further aggravates constipation as a drug-induced adverse effect. Because of the constipation, they will take the over-the-counter medicines and the palliative medicines for constipation. But at the end, it will worsen the condition. It is drug-induced adverse effect. So studies have also seen that most patients are dissatisfied with long-term laxative use and seek safer alternatives. because although they are taking laxatives, they are not satisfied. Homeopathy, based on individualization and miasmatic approach, offers a holistic long-term management option for geriatric constipation. So there is a little bit gap in the conventional medicine. Although they are using laxatives, but they are not able to solve the problem of the constipation. So what can we do? Mostly, it will provide a short-term relief or a temporary relief. And also, we have seen many patients that are dependent on laxatives for the constipation. We have seen some people need to take a tea before passing the stool, or always they would need to take laxatives before passing a stool. Also, sometimes some people also suffers from the addiction of the smoking. Unless they smoke, they can't pass the stool. So, because of all these treatments and issues, there are common side effects which can complicate the situations, like diarrhea, abdominal pain, nausea, vomiting, flatulence, etc. So we'll try to understand about the constipation. So what is exactly constipation? Although it is a symptom, but how we can understand it? Every people has their own definition of constipation. In every areas, although in India there are different states, every state has some people have some different presentations of constipation according to them. Constipation is defined clinically in India and globally according to the Rome's four diagnostic criteria, based on bowel frequency, stool consistency, and difficulty in defecation. Also, while considering dietary and lifestyle factors, which is very important in this condition. So, according to Rome's four criteria, diagnosis requires more than two symptoms, two or more than two symptoms for at least 3 months. Non-onset should be 6 months or prior to that. So, what are the symptoms? Straining in more than 25% cases of defecations, hard or lumpy stools in more than one-fourth of defecations or more than 25% of defecations. There is a sensation of incomplete evacuation and sensation of anorectal obstruction, need for manual assistance like digital evacuation or pelvic support, or the bowel movements are less than 3 per week. So these all are the some points which help us to understand what actually happens during constipation to different people. It is not about always about straining. It is not about always not passing the stool. There are too many symptoms of constipation. If you try to understand epidemiologically what actually happens in the global study of Rome Foundation, more than 40% of world's population suffers from functional gastrointestinal disorders, significantly affecting the quality of life. This is the study of the Rome Foundation. A global meta-analysis across 45 communities reported 14% prevalence of the chronic constipation worldwide. It is all about all over the world. If we talk about India, a multicentric Indian survey conducted across the 22 communities by Indian Society of Gastroenterology and the Indian Motility and Functional Disease Association, we found that 53% of Indians perceives themselves as constipated, which is a very huge number. So, what are the risk factors and the enhancing factors for geriatric age group for constipation? If you talk about the dietary factors, there is a low fiber intake which has been seen in many patients of the old age due to anorexia, loss of interest in food, difficulty in chewing, due to tooth loss, and also inadequate fluid intake, which plays a very huge role in producing constipation. Also, we all know about the lifestyle, about the old age. They have a very sedentary lifestyle with the lack of mobility and physical exercise. There are so many factors for that due to lack of energy, old age, joint pains, and many other diseases and factors. If you consider physiological factors, there are age-related changes in gut motility, weakness of abdominal, intestinal, and diaphragmatic muscles. Anatomical issues, if we talk about, there could be pelvic floor dyssynergia, rectal prolapse, or rectocele, and also certain medications can also produce constipation as a side effect, and also certain comorbidities which old age people suffers from usually. They also play a part or role for producing constipation. So constipation is not a limited term. It is called an umbrella term because it has many types. So if we try to understand simple constipation, colonostasis, it is caused by ignoring the urge to defecate, poor dietary fiber intake, inadequate hydration, reduced physical activity, and age-related loss of rectal sensitivity, leading to weak defecation reflex. This we all can understand. It is simple constipation, basic which we have just understood. Another type is neurogenic constipation. It results from dysfunction of enteric or vagus nerve affecting colonic motility, seen in neurological disorders or reflex inhibition due to disease of other organs. We all know there is an enteric plexus which is controlling the whole motor function of GI tract. So it plays a very huge role in maintaining the motility of the GI tract. Certain times there are diseases which are affecting the nerves, the nervous system, due to which there is a constipation. It is called neurogenic constipation. Next one is mechanical constipation. Due to physical obstructions such as tumors, diverticulosis, there is organ compression, and many other things, which is also included in mechanical constipation. But the main thing is it is obstructing something mechanical part is obstructing the pathway of the colon or tract, due to which there's an impaired evacuation or painful defecation. So it is called mechanical constipation. Certain inflammatory conditions like inflammatory bowel disease, we can say. So it also plays a role in constipation. Also IBS. It is inflammatory constipation. Another is toxic constipation, which is caused by exposure to the drugs or toxins such as morphine, cocaine, and heavy metals, leading to reduced intestinal motility. Hormones also plays a huge role in constipation. It is not limited to specific age. Hormones can affect to any age group, irrespective of gender. So, in constipation, which is associated with endocrine disorders such as hypothyroidism, pituitary dysfunction, which actually slows the digestive process. So, it is called hormonal constipation. Another is sedentary lifestyle constipation. This just because they have a very sedentary lifestyle, the constipation is created in that person, or that person suffers from constipation due to sedentary lifestyle because of the very low of physical activity. Another is psychogenic constipation, seen in psychiatric conditions such as depression, schizophrenia, often aggravated by psychotropic medications. And the last but not the least, of course, muscular and metabolic constipation due to weakened abdominal muscles, diaphragm, anal sphincter, or metabolic disorders such as diabetes and electrolyte imbalances. So all this type of constipation I have seen in patients also, and I have also seen in literature and researches which has done before. There are two distinct pathways. One is organic and another is functional. Organic constipation, which is occurring mainly due to mechanical obstruction of the intestinal lumen. There can be adhesions, tumor, hernia, intussusception, sigmoid volvulus, diverticulosis, which all covers the organic constipation due to some mechanical cause or anatomical cause. But if you talk about functional constipation, it arises from the functional disturbances rather than anatomical blockage. And we have seen the examples of neurogenic or understanding of neurogenic constipation, muscular constipation, metabolic or endocrine constipation, also psychological constipation. So now, if you try to understand the pathophysiology of constipation, mainly primary constipation, because usually geriatric age group suffers from primary constipation, which is actually the issue with the bowel movements or motility, including the secondary causes of systemic issues. So there are three processes for primary constipation, in which one is slow transit constipation or colonic hypomotility, in which there is a delayed colonic transit. Transit means the passage from the intestine. It may be due to neuromuscular dysfunction or reduced gut pacemaker cells, ICC, and the weak propulsive contractions. Contractions are weak. Symptoms can be seen as a bloating, abdominal discomfort, reduced urge, etc. Another one is normal transit constipation. Most common type, actually, we have seen in many people, even our age group also, because the transit time is normal. There is no slow, there is no fast, but there is a hard stool, bloating, difficult defecation, and response to the. It will actually respond to the fibers and osmotic laxatives. The third part is defecatory disorders. There's a problem with the muscles, sphincters, pelvic floor, which actually helps to expulse the stool out of the body. So there is a pelvic floor dyssynergia, sphincter dysfunction, a difficulty in stool expulsion despite urge. This type of constipation often needs digital assistance and facial posture. So we can see the images in which the one image is all about normal transit constipation, slow transit constipation, and the functional defecation disorder, in which the muscles plays and sphincters plays a very huge role in this inertia. The key idea for normal transit constipation is the problem isn't speed, it's about consistency. The key fact of slow transit constipation is maybe linked to the decrease in interstitial cells of occasion, the gut's pacemaker cells that mediate the muscle contraction. And for the functional defecation disorder, the exit mechanism is faulty. It means there is some problem with sphincters and muscle, which actually helps in expulsion of the feces or stool. We have all seen the Bristol stool chart many times in our studies, which actually helps the type of stool consistency, which actually shows if it is a diarrhea, constipation, or normal stool. So there are seven types in the Bristol stool chart, in which the type 1 and type 2, which denotes special hard lump-like nuts-like stools, which actually shows severe constipation, lumpy sausage-like, it's a mild constipation, and other different types of stool which actually we see in normal conditions and also in the diarrhea-like condition. But mainly type 1 and type 2 are seen in constipation for Bristol stool chart. So how we can proceed? So first of all, we have to rule out the alarming causes, because in the old age there could be many other factors which can play the role in producing such symptoms. We have to look for alarming signs like unexpected weight loss, nausea, vomiting. We can review all the current medications, because it can be due to medications also, like opiates, calcium channel blockers, antidepressants. Even for the underlying neurological disorders like Parkinson's disease, we have to go for secondary constipation causes also, or any mechanical causes also. So thorough history taking is very much mandatory. For laboratory investigations, we go, if we are finding the secondary causes, then we have to investigate about the systemic investigations. Like, for example, if it is about hypothyroidism and hypercalcemia, we have to order the investigations and try to rule out what actually is fault with the systemic causes, or whatever the system is affected, due to which the constipation is formed. Another thing is physical and procedural examination. Well, it only happens in very rare cases of unexplained symptoms of constipation, where digital rectal examinations for anorectal manometry is used to assess the pelvic floor dyssynergia. Colonoscopy is ordered only in the rare cases when there is alarming signs are present to rule out colorectal cancer. Usually, we do not go for colonoscopy very easily for constipation. So, Now, if we talk about the homeopathic approach, there is uh, three important aspects of treating this type of patient, considering miasmatic constitution, which address the inherited predispositions and root causes for causing the constipation, symptomatic homeopathic treatment or individualized remedies, which are specific for the presentation of the constipation symptoms, and a very important thing, which is the key role of diet and regimen in constipation. The essential foundation for health and bowel regularity, the base provides the vital support for all the intervention. Diet and regimen plays a very huge role in management of constipation, along with the medicines also. So, if you talk about the diet, mostly people ask, what should I eat to relieve this? What type of food should I eat? If we are addressing there is a low fiber intake and explaining the patient, they will ask what I should eat. So there are certain foods which are recommended for and which we should not eat also. So recommended foods are fruits, mainly papaya, apples, guava, bananas, ripe figs, soaked raisins. Vegetables like leafy green vegetables, carrots, butter, whole grains like brown rice, oats, quinoa, barley, legumes like lentils, chickpeas, kidney beans, nuts and seeds, almonds, walnuts, flax seeds, chia seeds. Hydration is very much important, of course. Usually, they are advised to take 2 to 3 liters of water. Herbal teas are advised, coconut water sometimes, buttermilk, of course, to uh, improve the gut health, gut bacteria and microbiota. Also, fermented foods like yogurt and curd. Which foods we should not take or we should avoid? They are deep fried vegetables, white bread, refined flour products, overly spicy lentil preparations, salted or fried nuts, sugary or carbonated drinks, highly processed pickles. A shift in paradigm of the holistic approach, homeopathic approach specifically. So for the diet and regimen, Dr. Hemant has also very well told in the aphorisms number 259 and 261 that actually advises careful investigation to identify and remove any obstacles to cure present in the patient's diet and regimen. Also in 261, the aphorism emphasizes establishing the most appropriate regimen, which includes lifestyle modifications and supplying what is necessary. Practical application of this also helps the patient to treat the patient, and also it is can be used as an adjuvant therapy, which enhances our treatment as an individualized homeopathic remedy, along with the individualized homeopathic remedy. Of course, lifestyle modifications will help to improve the routine, certain physical activities if possible. Also, the posture during defecation, you can advise them to use small stool to alleviate the feet. It creates a squatting position, which facilitates easier bowel movement. We can also counsel about the stress they suffer from. There are certain mother tinctures which are mainly used for geriatric constipation, which are rare mother tinctures, but not so often used. But it is very much good affinity for using in chronic constipation, especially in the old age. So the Cascara Sagrada, the main indication for this remedy is constipation associated with chronic rheumatism and muscular aches. Another one is Senna. This is also used in conventional medicine as a laxatives for constipation. But the main essence is a tonic for constipation with colic, accompanied by flatulence, muscular weakness, hard, dark stools with burning and rectum. Another one is Hydrastis mother tincture. If animals also fail, address this mother tincture can be used. The indication is no desire for stool, goneness feeling in the abdomen, and dull headache. The last one is not the last one, but last one from the most important ones is Cascarilla mother tincture, which actually represents for the hard stool covered with mucus or diarrhea alternate with hard lumpy stool. Diarrhea alternate with constipation we have heard many times. Diarrhea alternating with hard lumpy stool. Cascarilla is a very good mother tincture we can use. There are certain personalities or common polycrest medicines which we can use in old age group for constipation. There are too many drugs actually, but these are the very common, most common drugs which are used for treating the old age patients for constipation, which are well known for constipation. The first one is alumina. The main keynote is the inactive rectum. We all know the paralysis of rectum or the inactivity of the rectum is the main understanding of alumina for constipation. For older people with a great debility and lack of vital heat, even soft stool is passed with great difficulty because of the paralysis of rectum. Painful urging long before the stool. This is the chief indication for alumina. Another one is nux vomica, the ineffectual urge. The most common symptom of nux vomica is ineffectual urge. Irregular peristaltic action leads to frequent but ineffectual urging. A key remedy for constipation after the abuse of purgatives. Absence of a desire is contraindication because there is ineffectual urge in nux vomica. Also, other factors have been considered for the constitution, but these are the main key indications for constipation in old age group for this remedy. Another one is opiate. The keynote mainly is the obstinate obstruction. Obstinate constipation from complete inactivity of the intestine. Stools are hard, round, like black balls. Abdomen is hard and distended, effective where the strongest purgatives have failed. Obstinate obstruction or constipation also means flatus is also not passed from the abdomen, and that's why abdomen is distended. No stool is passed, also flatus is also not passed, and the abdomen goes on distending. And if the stools are appearing, it is like hard, round black balls. You describe this in their own words. Other remedies are like antimonium crude, also which is a very good remedy for old age constipation, specifically not only constipation but mainly in old age people. The overindulged patient, diarrhea alternating with constipation, especially in the elderly who tend to grow fat, aggravated by overeating. The thick white coating on the tongue is the characteristic which we all know. Another one is phytolacca, constipation with a weak heart. A keynote for constipation in old age accompanied with weak heart, burning, gripping pain in the abdomen, and a bruised feeling in epigastrium. The third one is selenium metallicum. Main keynote is the debilitated elderly or old age people. For great mental and physical debility, especially after exhaustive disease, large stool accumulate in the rectum. There is a desire for brandy or other strong drinks. Mostly selenium is used in all the senile conditions only. There are too many repertories. There are so many rubrics, especially for the old age constipation. I have considered complete repertory and also few rubrics which directly indicates the constipation in old age. There are too many rubrics which we can consider, but this is just a reference for understanding that this type of rubrics are being seen in repertory for old age constipation specifically. The examples are the rectum constipation, old people in alumina, timcrude, beretaca, bryonia, opium, phosphorus, selenium, sulfur. These all are the remedies in it, which are included. Rectum constipation, sedentary habit aggravation. There are remedies like bryonia, lycopodium, nux vomica, opium, sepia, sulfur. Right? Another one is rectum constipation drugs, purgatives after abuse of, as we have seen in the previous slides, that people actually uses laxatives and they are getting dependent on them. So because of the dependency, their condition again gets worse. So there's a typical rubric in the repertory that rectum constipation, drugs, purgatives after abuse of. They have taken too many purgatives every day and they are getting dependent on them. And because of that, the condition has been so worsened at present. For that, main drugs are China, Syncona, Holocynth, Adrastis, Nux vomica, opium, and many other drugs. Rectum constipation, urging absent, and accumulation of stool until large. Remedies are illumina, bryonia, natrum muriaticum, opium, sulfur. So these are some one sample rubrics to understand that there are directly given rubrics in our repertory for old age constipation, and all the symptoms which are seen in Rome's 4 criteria are actually being seen in the rubrics in the repertories directly. Now, the most important thing, ascending to the core understanding of the miasmatic theory. To achieve lasting results in chronic diseases, we must look beyond presenting symptoms to underlying constitutional framework. In homeopathy, miasm represents inherited or acquired disease tendencies that shape a patient's susceptibility and pattern of illness. Addressing the active miasm is crucial for removing the fundamental cause of the disease. We all know. So ultimately, we have to understand the miasm, which is actually the iceberg phenomenon concept. The symptoms which are appearing above has a very deeper layer of miasm behind it, which we need to treat and we need to understand. So that is a chronic constipation. So we will try to just understand the presentation of different miasms in constipation, how they represent constipation in the every patient. What is a soric understanding of constipation? What is a psychotic understanding? So we all know the soric miasm is for functional disturbance, which reflects deficiency or functional issues without significant structural change. Mainly, the stool symptoms are dry, hard, severe cases. In severe cases, may involve structural damage to the rectum or anus in severe cases, but mainly it is a functional disturbance. In psychotic miasm, we try to understand. They have a tendency towards overgrowth, accumulation, and fixation. We all know about these words when we hear psychotic miasm. But specifically, stool represents as mucus discharge. Excessive mucus in stool is a common characteristic. Also, mental state, if we try to see in such patients, are reserved, demure, harboring hidden fears. I not want to express what is happening inside, and I want to keep everything hidden inside. This mentality actually creates a conflict in the patient to harbor the things and not let it out. The thought process of not letting out and getting all the emotions and thoughts inside you, to not let people know, to not express out easily, and to hide their own emotions. Actually, this reflects the constipation also in psychotic people. If you try to look for the syphilitic miasm and tubercular miasm, the tubercular people have the sora part and psychotic part, or sora part or syphilis part together, which represents the erratic fluctuation between sora or psychosis or sora or syphilis. So there is susceptibility is very much high. That's why tubercular miasm is mainly seen in allergic and autoimmune disorder, mainly allergic disorders. So the physical symptoms are irregular bowel habits with alternating periods of severe constipation and normal stools. Suddenly, intense urges are seen. Stool characteristics are marked restlessness and dissatisfaction. There is a very much restlessness and even though after passing stool there is an ineffectual urge. If we go for the syphilitic miasm, we all know about destruction, degeneration, and irreversible changes. Physically, the stool is dark, offensive, and hard. So it is an integrated approach from foundation to constitution. Firstly, a deep analysis of patient's history and symptoms reveal the underlying miasmatic constitution, allowing for the remedy that addresses the root cause, leading to more profound and lasting improvement. Secondly, all the symptom presentations, what the patient actually writes to us, it will actually enhance make the totality of the symptoms, and which will help us to prescribe the remedy considering the miasm. After prescribing this individualized drug, by knowing the constitution and the miasm, the diet and regimen also plays a huge role in treating this type of individuals, this type of conditions in old age specifically. The holistic perspective ensures that treatment addresses all the contributing factors from diet to inherited predisposition, fulfilling the homeopathic principles of individualized care. So, with all this understanding, there is a holistic path forward for the ubiquitous malady. The main problem is the theoretic constipation, as we all know. It is just a summarization of what we have understood. Theoretic constipation is a complex and widespread condition heavily influenced by lifestyle, diet, and age-related physiological changes. But the limitation was conventional treatments like laxatives often provide only temporary relief. It can lead to dependency and unfavorable side effects. The homeopathic paradigm offers a comprehensive and individualized approach that utilizes the specific remedies, mother tinctures, and potentized medicines to address the root dysfunction, emphasizing the foundational changes in diet and regimen as an integral part of the cure, and also provides a path towards effective long-term management and improve the quality of life of the patient. So yes, this was all about the understanding about geriatric constipation and the utility of and the understanding of homeopathic perspective.
Thank you
You
so
can,
much, Dr. Mohit, for that truly insightful and thought provoking session. Let me see if we have any queries from the audience.
yeah,
I
sure.
guess. Audience, if you have any queries, please put them in the Q&A box and we'll try to take them up with our speaker. Uh, by that time, Dr. Mohit, anything you would like to say with your association with Elasha Homeopathic College as well as Homeopathy 360?
Well, I would like to say that Garde Vidyapith and Elisha Homeopathic College. Actually, it is a part of Garde Vidyapith, and I'd like to say with honor that I'm the part of this institute. And in this institute, we are growing every day with new innovations, ideas, growing the youth together, and updating ourselves and also the youth with their youth enthusiasm and also our enthusiasm to learn homeopathy every day with new perspectives, new researches, and also sessions like this and the platforms like Homeopathy 360, which give us the opportunity to also learn and make the people learn about homeopathy in our daily practices. So
Absolutely.
I would like to add also about Homeopathy 360 that since I was in my first year of homeopathy, where I don't know about homeopathy, I actually used to refer the website of Homeopathy 360, and for many articles which are there in Homeopathy 360 for references, especially for the therapeutics, for the group study, and so many other things which are available in Homeopathy 360. And also, my colleagues, even my students also have published many articles in Homeopathy 360. So it is a very good
Yeah.
platform. And also, we are all aware about the BHMS publishers and the books of homeopathy, which they have given to the homeopathy community. And it is we are actually blessed to have all these books to update and to learn from it. And also, it is available in a very concise form to understand, to it to get easily understandable to every student specifically, because every time it is not possible to spoon feed every students individually, where this type of books are actually helpful.
Very well said. Thank you so much for your appreciation. We
Yeah,
have a couple of queries. Can we take them?
yeah, sure, man.
So, Dr. Y.N. Rao is asking, can geriatric constipation pose the risk of colon cancer in the long run?
Well, definitely it can. Why? Because as we have learned that we are not treating just a constipation, we are treating the individual person. Considering the miasmatic background, the individualized remedy which we are prescribing, along with the diet and regimen. Diet and regimen only does not only includes the food and lifestyle, but mainly when the patient are actually narrating about the stress, the issues, the psychological issues they are suffering from. So we are actually trying to understand the patient as a whole, not just a constipation thing. As I narrated before that, people has a mindset, has a thought that we should not express ourselves. We should keep things hidden inside. If I will express certain things, certain outcome will happen, which is not favorable to me. That's why I need to hide my emotions. This thought process actually creates this type of pathologies or conditions, which is actually reflecting their own thought process. So by understanding the patient as a person, not just treating the constipation, but we are actually treating the individual. So if this thought process is actually becoming the base, the fundamentals for growing the cancer or cancer-like pathologies, so of course we can stop by treating not just the constipation, but by treating the mindset, the thought process of the person, the perception, the delusion of that person, by which they are actually living every day. Because by dealing with that delusion, we are actually making them aware that this is what you are thinking, and actually this is the problem. And this is not actually like that, which you are thinking every day. We can counsel them, we can give the remedy from which the state of that person which will get diluted, and because of which we will get free from that state. And also it can be prevented from this massive pathologies like cancer. So
Absolutely.
yeah, we can prevent it.
Absolutely. That is why homeopathy is holistic.
Definitely, yes.
Another question by Dr. Uday. He's asking, is actually a student, final year student from Elasha. He's asking which biochemic remedy can be, given in treatment whenever there is loss of minerals which lead to mineral deficiency. I'm not sure what.
Well, yeah, I can understand because we are actually using biochemical preparations in as an supportive treatment in our clinical practice. It is very usual because there are certain deficiencies which are playing the role because of the Schussler-Stolz theory. If we try to understand, it is all about the deficiency theory. There are certain minerals and salts which are actually maintaining the equilibrium in our body, because of which, if there is a deficiency in all these salts, it will create an imbalance in our body. So, for the constipation, if we try to understand, in specifically old age group, if there is certain salts, biochemic salts, which we can use in this type of diseases, but of course, we can just use as a supportive therapy. But in this supportive therapy, remedies like Silicea and Calcarea floor are mainly used for the solving the constipation. Why? Because these two remedies actually act in the connective tissue of our body. It will actually enhance the gut motility, the gut water content. It will enhance this physiological processes, which will actually lead as a supportive role in treating the patient as a whole. So yeah, we can use biochemical remedies, but specifically as a supportive medicine, not only the prescription. Our prescription should be based on the individualized drug, the patient's constitution, considering the miasm, Along with this diet and regimen, and we can also add biochemical salts. Yes.
Absolutely. Let me just see. Yes, another question by Dr. Ginoya. What to do in drug-induced constipation, where the patient may be taking allopathic medicines for a long time, or homeopathic remedies, or both. So in that case, what do you suggest?
Well, it is a very good question and huge dilemma, I can say, because people actually chooses homeopathy usually in this unaware public, which don't know about homeopathy, which works wonders. They come to us at the end after taking all the medicines which are available in the conventional medicine. Also, they take the under over-the-counter medicines on their own sometimes. So, what to do in such cases? So, as we have seen one rubric about the rectum constipation, abuse of purgatives are. So, of course, years back, they have written, our stalwarts have written, they have given this rubric in our literature. So, it has something, some meaning to it. It means our remedies have ability to act in certain situations where there is abuse of purgatives. We have also used Nux vomica in many cases where there is a multiple conventional medicines have been taken. Even though multiple homeopathic medicines have also been taken, then also we use Nux vomica as a remedy to uh, set the equilibrium again, and again we can prescribe the new medicine as a fresh case. So in drug abuse situation, first thing is we have to address which drugs they are using, which has the side effects of constipation. If we are taking the history and we are not getting any type of secondary causes of constipation, so we have to think about what type of medicines they are actually on. And also there are many medicines which have side effects which can cause constipation. If we are addressing their medicines, we cannot stop that medicines at present. But at least we know what is the actually maintaining cause for constipation. So if we are addressing the patient as a whole again, as an individual, then if we are healing the person as an individual, not just the disease, then whatever medicines they are on, they can also be reduced. It will take a time, but reducing their medications, which are not actually helping them but adversing them in a way, we can just reduce the amount of medicines gradually, along with the supportive medicines of homeopathy too. And gradually, we can just stop the medicines and also the abuse of the laxatives. And also, if we are treating for the constipation, if we are helping with homeopathic medicines, gradually the laxative and other drugs which are they are dependent on will decrease for using for the constipation. So dependency will decrease, so abuse will also decrease. So yeah, we can deal with this situation like this.
Wonderfully answered, Dr. Mohit. One last question we'll take by Dr. Priyanka. She is just giving
Okay.
case presentation. A bedridden patient who is not able to do any work by themselves and loss of appetite, suffering with constipation and piles. So, any medicine that you can suggest or a homeopathic approach that you would like to tell?
Yes. Actually, the patient is bedridden. So the first thing is a complete sedentary life. We cannot tell the patient to move. So there is a complete loss of motility, of course. Loss of appetite is there because, of course, there is a constipation due to the long time bedridden condition. It is having the loss of appetite, also due to old age, and there is a piles. Then we can use the homeopathic approach of this patient. This is the question, right? So yes, definitely we can use homeopathic approach in this condition. How? First of all, why this patient is bedridden? This is a question mark. Second thing is there should be some modalities and some information about the piles and constipation for prescribing this. So we can consider the symptom totality of constipation, piles, of the bedridden cause of the clinical diagnosis, by what reason they are bedridden, along with what is the present state of that patient. in this condition, what is the actual feeling of that patient being in this condition? We have to ask. If they are complaining about constipation, we can understand because they are suffering about the physical symptoms. But what is their perception being in this condition? They will try to narrate their feelings, their symptoms with their emotions attached to that symptoms. From that, we will get the clue and hint to ask and clear about what is the present state of that patient. And with the help of this, we can reach to a very similar remedy if the patient is not able to convey much more symptoms. But at least we can reach to a very near similar remedy which can actually help rather than just prescribing as a therapeutic medicine that I would like to suggest. Because there are many therapeutic medicines. We can also use the tinctures which we will discuss in the session. But I will suggest that rather than using the blind therapeutic remedies, we should actually get some information and try to match that information part with the similar remedy. At least we can help some way to that patient. So yeah, this is the way we can deal with it.
Right. Any organopathic remedies that you would like to, put pressure on in case somebody gets no, constitutional symptoms?
So in the tinctures which I have described, it is mainly used for constipation, typical use for constipation. Although they have given the indications of using it, but in many cases, the senna mother tincture is used for treating the directly as organopathic. But again, I would like to suggest we should at least get certain information about the patient based on which we should prescribe. Of course, I can understand there are certain situations which we are not getting any information from the patient. So at that moment, we can use this mother tinctures for at least aiding the patient some way we can. So yeah,
Mm. Right. Uh, Another question,
and
Dr.
also,
Subasiri.
uh,
Yes, please
yeah,
continue.
yeah. No. I just want to add one thing in last question that
Right.
there is Homeolex tablet is actually a patent medicine which is available in different companies in our homeopathic pharmacy. I have used as an organopathic remedy as a Homeolex tablet because whenever the patient is not available or there is no information available, or relatives is asking for that patient and the patient is not able to contact with us. In that
Yes.
situation, I prescribe Homeolex tablet. And
Okay.
I can just definitely say that with that one tablet, next day, the patient passes stool, although the chronic constipation is there. They will pass the stool. At least they will get the aid. Although it is not the right way, but in that situation, this is what we can do.
Right. So I think that is it for today. Thank you so much, Dr. Mohit. That was a truly insightful and thought-provoking session. And thank you,
Thank you
audience, for
so much.
being thank you, audience, for being such an engaged audience and joining us today on Homeopathy 360. Stay tuned to Homeopathy 360 for more such enriching webinars featuring some of the top minds in homeopathy, like Dr. Mohit. If you are a BHMS student, do participate in the quiz marathon, which is happening on 14th and 15th of January. The registration link is available on Homeopathy 360. Dr. Mohit, thank you so much for your time.
Thank you so much, ma'am, for the opportunity.
Good night, everyone. Good night, sir.
Okay, thank you.